Brian, Biotin bottles keep promising thicker hair, stronger nails, and glowing skin. Is this one of those rare supplements where the beauty claim is real? Or is it mostly selling a deficiency symptom back to healthy people? And why does the story sound so convincing? If lack of biotin can cause hair loss and dermatitis, why wouldn't extra biotin push hair and nails above normal?
That's the central distinction. Biotin is not a keratin brick you stack into hair. It is vitamin B7, a water-soluble cofactor that gets attached to specific enzymes called carboxylases. Those enzymes help run gluconeogenesis, fatty acid synthesis, and amino acid breakdown. So biotin is essential for cells, including skin cells, but its basic role is metabolic traffic control, not directly forcing follicles to grow faster. When biotin is truly inadequate, fast turnover tissues show it. Deficiency has been associated with hair loss, brittle nails, skin rash, dermatitis, and neurologic problems like ataxia or seizures in severe settings. That is why the beauty connection exists. But the evidence trail begins with deficiency and rare disorders, not with healthy adults taking large doses for cosmetic upgrades.
So who is actually likely to be low? Are we talking about ordinary people with some shedding, or specific situations where biotin biology is disrupted?
True deficiency is uncommon in healthy adults eating varied diets. Higher risk contexts include biotinidase deficiency, long-term parenteral nutrition without biotin, prolonged raw egg white intake because avidin binds biotin, and some anticonvulsant therapy that can interfere with absorption or increase breakdown. Pregnancy and lactation modestly raise needs, but that usually points toward adequate intake, not beauty megadosing.
What about brittle nails, specifically? People often say, "My nails stopped splitting," and that feels more measurable than hair growth. Is there better evidence there?
Before the nail answer, there is a safety trap people miss. Many hair and nail products use milligram doses, far above the adequate intake measured in micrograms. At those levels, biotin can interfere with streptavidin biotin immunoassays. Depending on the test design, results can look falsely high or falsely low, including thyroid hormones and troponin, the blood marker used when clinicians suspect a heart attack. For nails, the signal is possible, but not strong. Small studies and case reports suggest some people with brittle nails may see improved thickness or hardness, but designs were limited, and many did not prove participants were biotin deficient first. For normal nails, Harvard's review is blunt. There is a lack of published evidence that biotin improves normal, healthy hair or nails.
If someone starts biotin for hair, how would they even judge it fairly? Hair changes slowly, shedding has cycles, and some conditions improve on their own, right?
Exactly. If a clinician suspects deficiency, improvement after replacement can be meaningful. But for self-experimenting without a deficiency, use boring measures. Same light scalp photos, nail splitting frequency, and whether other causes were addressed, like iron status, thyroid disease, medications, traction hairstyles, or inflammatory scalp disease. If nothing changes after a realistic growth window, the story should change from more biotin to find the real cause.
What does food-first biotin look like? If the adequate intake is tiny compared with supplement doses, can normal meals usually cover it?
For adults, the adequate intake is about 30 micrograms daily, and lactation is about 35 micrograms. Biotin is widely distributed in foods: egg yolk, liver, nuts, legumes, whole grains, and some vegetables. A recent almond snack trial was not a biotin trial, but it showed how a whole food pattern can raise several nutrient intakes, including biotin, while also improving some cardiometabolic and gut inflammation markers in that study population.
I've also heard the gut microbiome makes biotin. Does that mean gut health replaces dietary biotin? Or is that another claim people stretch too far?
Gut microbes can synthesize biotin, and newer microbiome studies sometimes detect shifts in biotin metabolism pathways after fiber or probiotic interventions. But those studies are usually about microbial function, constipation, or pregnancy microbiota, not proof that a probiotic grows hair by raising human biotin status. The practical message stays modest. Varied diet, cooked foods, and medical evaluation when symptoms suggest deficiency. The most medically important advice is simple. Tell clinicians and labs if you take biotin, especially doses above 1 milligram daily. The FDA warned in 2017 that interference had contributed to at least one death through a falsely low troponin result. If chest pain, thyroid testing, fertility hormones, or emergency care are involved, a beauty supplement becomes clinically relevant information.
So the clean takeaway is, biotin is essential. Deficiency treatment is real. Brittle nails have a small and uncertain signal, but healthy hair growth claims are weak. And if someone still uses a high-dose product, they should not treat it like harmless background noise. They should disclose it before labs and rethink megadosing if there is no measurable benefit. Is that the honest version?